as you can all see, Dr. Stephen Kohl is with us this evening. I'm going to give you a little bit of a background because he is totally responsible for this reformulation of a great product in OptimEyes, and now we've even got a better product in Super OptimEyes, and he'll explain why that is. A little bit of Dr. Kohl's background before we get into that. He was a diving medical officer, UDT, SEAL Team San Diego between 1970 and 74. Ophthalmology residency at Naval Hospital San Diego 1974 through 1977. Staff ophthalmologist, Navy Hospital San Diego 1977 through 78. And from there he went into private practice 1978 through 2005. So clearly we have an expert in the field with a significant amount of experience. Dr. Kohl, welcome, and thank you so much for your time. Welcome to the call this evening.
Thank you very much, Steve.
My pleasure. And let's just get right to it. I know we had a phone call here about a week ago, and you were basically hanging upside down from the ceiling with excitement because of this new formula that you finally got through, and it's in the process of being made as we speak. So why don't you tell us what's so great about this new Super OptimEyes?
Well, as John Paul said, we've been working for many, many years to find a product that really is totally focused on complete ocular support with antioxidants, with amino acid called taurine, and with an increase in the retinal carotenoids, which I call lutein and zeaxanthin. Well,
as a follow-up with that, what increases did we make, and why did you make them? I mean, I know that there's products out there that have zeaxanthin and lutein as well. So what was the reasoning for the increases and the dosage?
Well, we modified the product in a number of ways to have nutrients that totally focus on ocular support. And so in the second arm of the AREDS-2 study, which ended in 2013, they were able to show that by adding lutein and zeaxanthin to their original formula, they reduced the progression or potential progression of macular degeneration by a significant portion. There's another article in Ophthalmology in 2015 with a study of more than 100,000 nurses and healthcare practitioners showing that those that had the highest intake of lutein and zeaxanthin had a greater than 40% decrease in progression and or symptoms of age-related macular degeneration. They also showed in the same study you could reduce the potential progression of cataracts by over 20%. The other study that helps us is in a journal called Nutrients in 2016. They again showed that the higher doses of lutein and zeaxanthin increase what we call macular pigment optical density, which we'll talk about later. And they also showed in that same study again that with zeaxanthin, lutein, and other nutrients, including vitamin C, we can reduce the potential progression of cataracts by almost 20%.
So go ahead.
No. So if you look at lutein and zeaxanthin, which are the primary players in ocular health with the supporting nutrients that we now have in Super OptimEyes, they support macular photopigment function. They support the retinal pigment epithelium, which is the layer behind the retina or next to the photoreceptor cells that's so important for the health of those cells. They maintain the carotenoids in the retinal pigment epithelium. In fact, they're the only two carotenoids found in the retinal pigment epithelium. They also provide UV and blue light protection to the macula itself.
All right. Well, that's a mouthful and a half. But as I was fortunate to see the label, I noticed that you mentioned taurine earlier, and bilberry extract, ginkgo, etc. What are the significance of those nutrients in there and the dosage that they are in there? Why are they in there to begin with?
Well, as far as taurine is concerned, it's a specific amino acid that focuses on photoreceptor health in the back of the eyes. The photoreceptor are the rods and the cones that perceive the image that you see as far as your eye concerned. And it supports the health and wellness of the rods and cones. It also triggers synthesis of proteins for retinal repair for rods and cones at that time. But there are also other nutrients, as you mentioned. One is selenium. It's a very powerful antioxidant that protects the cellular membranes from oxidative damage. There's another one called N-acetylcysteine, which is a precursor to glutathione. Glutathione is one of the premier antioxidants in the eyeball itself. You can't take glutathione, you have to take a precursor, and the body then converts it to glutathione peroxidase. A very, very important item as far as the health of the retina is concerned. And then we talk about ginkgo. Ginkgo, as we know, improves or supports circulation in many tissues, obviously including the retina. It helps with the plasticity of the red blood cells and the oxygen carrying capacity of those cells, which is of vital interest as far as the retina is concerned. And then, of course, we've all heard Tom Tierney speak before Bilberry extract and how it affects the night vision that we have, especially with the rods, and helps regenerate visual purple, which is part of the vision process in seeing.
Well, so it's loaded, to say the least, with,
for sure,
with the things that are clearly important for a layperson like myself. I mean, it goes way over my head, but the important part is it's getting your attention. And one of the things I want to do is tap into a little bit of history as a healthcare professional in private practice for 27 plus years. As a layperson and as a general patient, we go into our healthcare professional and ask them questions like, what can I do for ocular health? What can I do for prevention? You go to your medical doctor. What can I do? What do you recommend? And I know you and I have had conversations in the past, and the whole reason for OptimEyes even being available to us at Body Wise now is, a little bit of your frustration as to making recommendations before we had OptimEyes. Would you just do me a favor, take a couple of minutes and kind of go into that and how this all took place to begin with?
Absolutely. In private practice, we were seeing patients because in ophthalmology, you see an older generation of patients to begin with. And we were looking for a product to really support good ocular health. And there's just nothing on the market back in 1995, 1996. So we were fortunate to spend some time and do some research on nutrients that were really critical for ocular support. And we were blessed with the help of Tom Tierney, Margaret Ames, some of the original people in Body Wise that helped us or let us develop this product for ocular support. And we had that for 25 years until we get to the present time when we know that we can increase the retinal carotenoids, which are lutein and zeaxanthin, and then pair them with the antioxidants we already mentioned and with taurine, which is so important with all of us with our iPad use, our iPhone use, our smart TVs, and really create a product that is next to none on the marketplace out there. There's just nothing like it. So again, with the support of the present Body Wise team, which we can talk about later, we've been able to develop this product. And if you go look at the marketplace, there's just nothing on the market that compares.
Well, that's what I was looking for. I was going to ask about that, and you covered it perfectly as far as, back 25 years ago, there really wasn't anything of substance, and you find yourself in the same position today. Unfortunately, you're involved in Body Wise, and you brought the research to us. And like you said, the team at Body Wise stepped up and said, we're about leading edge. We're not about following everybody else. And frankly, that everybody else is not setting a very good pace. So fortunately, you're with us at Body Wise, and the team at Body Wise listens. So with that, and you kind of touched on it, who benefits from Super OptimEyes? I mean, is it only going to be an aging population, or is it a cross section? Do you take this from a preventative perspective, or do you wait until we go to you and you say you're screwed up and hey, we got to do this. I know I'm dealing with a serious medical term, but
That's
at
okay.
any rate, all joking aside, I mean, do we have to wait for the symptoms, or is it something that we should do in the front end?
No, absolutely not. And I think that, family history is a terribly important part of this equation, because those that have more severe macular degeneration, some of their offspring are going to develop the same problem too. So from a preventive point of view, OptimEyes really does support optimal health. And there's some really interesting studies out there, and that is that patients over 60, almost 30% of those people have some form of visual impairment that can't be corrected with glasses or with cataract surgery. In the same study, it showed that patients over 65, there's another 30% that have early or progressive macular degeneration. And again, those patients, families, and children need to be aware of what's going on, because that's a good place to start with ocular support with nutrition. There's another group called Bright Eye Foundation, which is focused on research for retinal health. And they showed the same thing that we've been talking about, that in 2017, their first study showed there are 11 million people with some form of macular degeneration. And they predict by 2025, just 4 years from now, that number is going to increase to 20 to 25 million people with some form of macular degeneration. And they again show that the higher doses of lutein and zeaxanthine not only support good retinal photocell function and good health of the macula, but also tend to decrease the risk of developing cataract formation as we age.
Well, that's pretty substantial information. And one of the things that I know we want to do is open this up for Q&A, but I know that you want to say a couple of words to the team at Body Wise.
I do. And I have to be very grateful for Bill and Shelley Farley for all their support in developing this, and certainly have to be very thankful for John Paul for all of his support, all the effort he's gone into to help me, develop this product and present this product. So those three people are really instrumental also in bringing this together. And I know that Shelley Farley in specific has great feelings for OptimEyes, because she's tried other products and had some very unexciting results or unhappy results with other products.
Well, okay. Well, I know we want to open this up for Q&A.
And then for Dr. Kohl, if someone's had macular degeneration for a while, will they possibly still slow up the progression of macular degeneration?
You're cracking up a little bit, so it's a little hard to make sure I'm hearing you. However, if someone already has macular degeneration, no matter what level it happens to be, it's very important to support that retina with as good nutrition as you possibly can, because that tends to prevent the progression to more serious forms of macular degeneration.
Thank you. That's what I was wondering.
And let me just add to that. In my private practice, we had lots of people on the regular OptimEyes. And even in some of my more difficult cases, we increased the dosage to 4 per day, 2 in the morning, 2 at night. And I remember some very specific cases that did just significant improvement, and with the right nutritional support.
I see that Tony Nelson's still muted out, but I know Tony had typed a nice little message in there. I was wondering if maybe, Tony, you could repeat that for everybody.
So Bob and I have always taken OptimEyes, and I'm reading it, and now we're in our 70s. Neither of us yet needs cataract surgery or have the macular degeneration that runs in both of our families.
Ask them how much.
Well, certainly that would be a good place to depending on what your status is, a good place to make sure you continue taking the Super OptimEyes. Excuse me. And depending on the status of either or cataracts or potential macular degeneration or even a family history of macular degeneration, those are times when you might even want to increase the dosage, as I mentioned earlier.
How much zeaxanthin is on there?
Well, there's 4 milligrams of zeaxanthin and 20 milligrams of lutein.
Great, thanks.
What about dry eyes, Dr. Kohl? Will it help dry?
Anything that supports ocular circulation and ocular health is going to help with dry eyes. I know there are some people who took the previous formula, the regular OptimEyes, before we enhanced it, that had dry eyes and reported a nice result taking the nutritional support from OptimEyes, and there should be no difference in Super OptimEyes, if not better.
One of the things, Dr. Kohl, that you've said quite often on this call, and which I find interesting, is if your family, you have a family history, and Tony had mentioned that both she and Bob have a family history of eye issues. So, I mean, so obviously if you have that, this is more than appropriate to take. And I haven't seen how many per day is the normal support dosage. I haven't seen the capsule count or the pill count. Is it come in capsule form?
It does come in capsule form. That was one of my requirements, that we keep it in capsule form, because I just think the capsule form presents itself to better nutrition in the body and better absorption from my perspective, especially in the older population, because a lot of us don't have the stomach acid to dissolve some of the products we used to be able to do. I assume, but we can ask Jean Paul, that the dose is still 3 capsules per day. Is that correct?
Correct.
So that if I had a strong family history, then I would certainly tend to increase my dose, like I mentioned, to 2 in the morning, 2 at night. The fact the product is less expensive but is far superior are 2 big pluses for us, in my opinion.
Yeah, better product at less price. I mean, it's the best of both worlds last time I checked.
Yes, sir.
Does anybody else have a question or comment?
It's Adrienne Morrison.
Welcome, Adrian.
Hi, John Paul. How are you?
Good, good. You have a question for Dr. Kohl?
Yes, I just wondered, would one expect taking the Super OptimEyes to have any improvement in vision, or is the main purpose to stop deterioration?
Oh, no, I mean, it's there to support good vision in general, as we mentioned. It helps with blue light stress, which is again and UV, which is from iPhones, iPads, smart televisions. It helps with retinal metabolism and retinal function. It supports retinal circulation. It does tend to, because the glutathione in the N-acetylcysteine helps maintain vitamin C levels in the eye. Those are known to slow down cataract progression, if one even has any cataract. So that I think it's good for support. It's good for treatment support. I can tell you personally, I've been taking OptimEyes since the day it was invented or developed. We developed in '95. I'll tell you a little story. Won't take long. I had a retinal malignant melanoma in my left eye. And through all the treatment during that, I took 4 of the OptimEyes per day, 2 in the morning and 2 at night. Granted, I saw some doctors for some really good medical treatment, but I also maintained my ocular support. At this moment, as we speak, my eye that was involved, my left eye, is now my reading eye and reads 20/20.
Wow, that's fantastic.
So I think, in all phases of trying to maintain good vision, OptimEyes fits right in there for support for total ocular health, especially now.
Well, with people spending so much time on laptops and cell phones and everything else, and
you are correct.
It does a lot of damage, so.
It does.
What does the quercetin and what does the selenium do in this product again?
Well, remember the selenium is another antioxidant that helps with retinal cellular function and maintains the antioxidant status of the photoreceptor cells. We talked a little bit about that before because of the macular pigment density, which can be measured, which measures the amount of lutein and zeaxanthin that's in the macula. And selenium is another supportive antioxidant that fits right into that, armamentarium.
Can I make a comment? Yeah, I'm Bob Nelson. I just want to comment. Last time you were on, you talked about the amount of zeaxanthin in OptimEyes, and it was not as much as in another product that my eye doctor recommended. And I'm glad that you increased it. For last year, we've been supplementing ourselves with zeaxanthin to make up for the difference. And I'm glad that you guys have got the amount of zeaxanthin up over to the 4 now. That's really good news.
That's great because you won't have to worry about that because Super OptimEyes, like I said, has 20 milligrams of lutein and 4 milligrams of zeaxanthin. There's no product on the market that has that amount of retinal carotenoids in it. And so we're going to get a lot better support as far as our retinal health is concerned, our ocular health in general is concerned, along with the other antioxidants and the taurine, the amino acid that's in it too.
Really good news. That is good news.
Hi, I have a question. It's about glaucoma. I didn't hear anyone say that this Super OptimEyes is good for glaucoma.
Oh, glaucoma. I'm sorry.
Yes.
Well, I mean, the taurine, which supports retinal circulation, and the other antioxidants, especially N-acetylcysteine, and ginkgo that's in it. The N-acetylcysteine converts to glutamate, I mentioned earlier, and it does support what you call trabecular meshwork function. The trabecular meshwork in open angle glaucoma is the culprit. And so a lot of our medications we take are to help improve circulation and fluid release from the eye itself. So N-acetylcysteine supports that, as does taurine. And I will tell you, in my personal practice, when I was practicing, I had glaucoma patients on OptimEyes and seemed to get better ocular control, ocular pressure control on the product than off the product.
So how many should one take to help with the glaucoma?
Well, I guess that's a very hard question to answer because I don't know exactly your status, but I would tell you, depending on how many drops you're taking or what your status is or what your optic nerve function is, I would take the normal 3 a day. If you were having trouble with, with control of pressure, you might consider taking 4 a day, 2 in the morning, 2 at night. But I need to be careful. We're not here to diagnose or treat.
One of the things that I'm just from an observation perspective, John Paul and Dr. Kohl, I mean, I know that a lot of people look at OptimEyes as someone, 60 plus years old, but the more I listen to this, if you're looking at devices of any kind with all the different lights and stuff, as I'm hearing, it probably makes sense for people that are even younger. And it seems like our younger population has got their face in a computer, a laptop, or whatever constantly. I would think that it would be appropriate for them as well.
Steve, I think you're absolutely correct. And, most of our high-tech people are sitting behind computers and on laptops and whatever. You go to a restaurant every day and all they do is look at their tablet to place your order and stuff like that. So I think, we would really need to move our target audience down to the 40s for sure, and then up because of the impact of their lifestyles and the blue light and UV, et cetera.
I wonder if Dr. Kohl might touch on some of us as we get older we find driving at night a little more challenging. Things don't seem to be as sharp and in focus as they once did. And I know we have Bilberry in the product, which we had in OptimEyes as well. But could you comment a bit about the unique properties of Bilberry and the role it plays maybe to help us drive with a little more confidence at night?
Well, bilberry is a really important nutrient, as we've heard about way back in the early days with Tom Tierney, because it helps the photoreceptors that are more functional in dark conditions, which are the rods. It helps those cells metabolize better and recreate a pigment called visual purple. And visual purple is needed to promote better vision in dim light situations. The other thing, just as an FYI, nearsighted people tend to have a little more problem at nighttime anyway, because when the light is dim, they pick up a little extra nearsightedness optically, and they have a little more difficulty. So making sure someone's prescription for glasses, should they wear them, is up to date. It's really important.